The aftermath of World War II left Britain with significant social and economic challenges. The war had devastated much of Europe, and Britain faced the task of rebuilding its cities, infrastructure, and economy. Amidst this backdrop, there was a strong desire for social reform to ensure that the hardships endured during the war would not be repeated in peacetime. In 1942, economist and social reformer William Beveridge published the landmark Beveridge Report, which outlined a comprehensive plan for social insurance and allied services. The report identified 5 giant evils in society: want, disease, ignorance, squalor, and idleness. Beveridge proposed a welfare state to address these issues, with universal health care as a key component. Before the creation of the NHS, healthcare in Britain was a patchwork system. Access to medical services largely depended on one's ability to pay, with many relying on charitable hospitals, workhouse infirmaries, and private doctors. National health insurance, introduced in 1911, provided some coverage, but it was limited to certain workers and did not include family members or cover all medical needs. Aneurin Nye Bevan, the Minister of Health in Clement Attlee's Labour government, became the driving force behind the creation of the NHS. Bevan, born into a working-class family in Wales, was acutely aware of the inequalities in healthcare access. He was determined to create a system that provided comprehensive healthcare to all, free at the point of use. The National Health Service, NHS, was officially launched on July 5, 1948. The founding principles of the NHS were revolutionary. It was to be funded through taxation, provide care based on clinical need rather than ability to pay, and be available to all residents of the United Kingdom. The establishment of the NHS faced significant opposition, particularly from doctors and the British Medical Association, BMA. Many doctors were concerned about losing their independence and being controlled by the state. Bevan navigated these challenges through negotiation and compromise, famously remarking that he had stuffed their mouths with gold by offering generous compensation and allowing doctors to retain some private practice. The creation of the NHS marked a profound shift in British society. For the first time, everyone had access to healthcare, regardless of their financial situation. This access dramatically improved public health outcomes, reducing mortality rates and increasing life expectancy. The NHS not only provided treatment for illnesses, but also focused on preventative care and public health initiatives. Immunization programs, maternal and child health services, and health education campaigns helped to reduce the incidence of diseases and improve overall health standards. The NHS brought economic benefits by ensuring that workers were healthier and more productive. It also provided financial security for families, who no longer had to worry about the cost of medical treatment. The availability of free healthcare contributed to greater social cohesion and a sense of collective welfare. The early years of the NHS were not without difficulties. The demand for services was higher than anticipated, leading to financial strains and resource shortages. However, the foundational principles remained strong, and the system adapted to meet growing needs. Over the decades, the NHS expanded its services to include mental health care, dental care, and advanced medical treatments. Technological advancements and medical innovations continuously shaped the scope of healthcare provided by the NHS. In recent years, the NHS has faced significant challenges, including funding pressures, an aging population, and rising healthcare costs. Despite these issues, the NHS remains a beloved institution in Britain, often regarded as a symbol of national pride and social progress. The NHS has served as a model for universal healthcare systems around the world. Its principles of equity, comprehensive care, and public funding have inspired many other countries to pursue similar healthcare reforms. The NHS is deeply ingrained in the British identity. Polls consistently show strong public support for the NHS, with many viewing it as one of the greatest achievements of the post-war era. It represents a commitment to social justice and the idea that healthcare is a fundamental human right. The creation of the NHS was a transformative moment in British history. Born out of the ashes of World War II and inspired by the vision of a fairer society, the NHS has provided comprehensive healthcare to millions of people for over 7 decades. Its impact on public health, economic stability, and social cohesion is immeasurable. Despite facing ongoing challenges, the NHS stands as a testament to the enduring power of collective action and the belief that everyone, regardless of their circumstances, deserves access to quality health care.